As my colleague from Mumbai mentioned, they're going to change depth. So you're going to find them superficially, just lateral to the lip, and then they will pierce through the muscle and become deeper. So if you want to find the artery, there are 3 positions where you are likely to find the artery, which is going to be superficially, in the muscle, or submuscular. So those are the 3 positions. Why are we talking about layers and this different arrangement? Well, the reason is because the vasculature is incredibly variable, as you can see here. You have even patients, significant percentage of patients, as you can see here, that have their cutaneous lip supplied by the infraorbital artery, from branches of the infraorbital artery. So this is an area that is subject to potentially quite significant complications. So this is why we always talk about depth when we are discussing dermal fillers, because these blood vessels, we are likely to find them in the deeper planes rather than the superficial planes. So more likely to find them in the submuscular plane, so in the deep plane, in the muscular plane, and then we have a less risk of finding them within the superficial plane, the subcutaneous plane. So therefore, our recommended injection depth is the following. So if you're injecting the lip itself to stay superficially, so anterior to the wet and dry border, if you go to the cutaneous lip, especially around the philtrum columns, because remember we have a superficial and a deep branch of the artery there in the columella, so those injections I would suggest that you go intradermal, so very, very superficial. Periorrheitis, so a challenge really. So these dynamic lines, they're only visual on animation, and then as we become older and you factor in skin aging, they are static as well. So why do they occur, and why can they present a challenge for us as injectors? Well, the skin will age, but also remember the subcutaneous fat here will atrophy, which essentially means that we will have no layer 2. So you have muscle, and then attached to the muscle, you have that aged skin. And this is why this could potentially be a challenge for us to treat. So how do I treat these lines? Well, first of all, I'm going to treat the vermilion border. So with this, I'm doing an antegrade injection with a 4mm needle. And I'm not going to elaborate on this too much because Lee is going to do an amazing demonstration here. So I'm treating the vermilion border because it goes in the opposite direction as those perioral rhytids. And sometimes, even just by doing this, you're going to have a very good correction of those barcode lines. But what is next? Next, I'm going to do a subcision. So I'm going to use my cannula as a surgical instrument and separate that skin from the muscle, and then use a very fine filler in order to restore that subcutaneous fat, create a little bit of padding between the muscle and the skin. And I do this with a cannula. This is a 25 gauge, 38mm cannula, and I'm not injecting any filler here. I'm just creating a plane there for my HA to be placed. So here I want a very stretchable HA with a low concentration of hyaluronic acid. So I'm not injecting yet until I can move freely my cannula underneath the skin like a windscreen wiper, which you're just about to see there. So this is where I've created a plane and I can start injecting my product. Very low volume, so anything between 0.1 and 0.2 per quadrant. Then after doing this, I'm going to get my patient to animate. So this clicker is a little bit tricky. Let's see there we go. So I get my patient to animate. So here I've just done the vermilion border and that subcision. So you can see the improvement just by doing that. So this is something that I would really recommend. This is a very dynamic area. Therefore, your dynamic assessment is incredibly important, even throughout your injections. So what would I do now if there was still a line there on animation? Well, I will switch to a needle, and I will do just a little intradermal bleb, so flat blanching, superficial dermal stretching, like that. Because remember, the more layers we treat, the better the outcome for our